So good day everyone, I'm Vanessa Acera and I'm gonna talk about the cystic fibrosis modification and assistive technology. So here are the list of modifications of cystic fibrosis in the classroom. So first is to always keep things clean because a CF student is afraid of germs. Not to be overreacting, but that's the truth. And always practice hygiene when approaching the students with CF or other classmates to have an infection prevention control. Another is to give a student with CF a frequent access to the bathroom, especially when that student is having a stomach ache, or if he or she needs to fart, or if the coughing triggers a lot, so the student needs to go to the bathroom. Also, encourage your students to keep a box of tissues to cough into and a trash can to dispose of the tissue near their desk. Also, have a modified activities, especially in PE class, and allow the students to be included in all games and activities in which he or she is interested. Also, have a modified seating arrangement with not so wide range of distance between its classmates' seat, and its seats must be near at the comfort room or near at the door for easy entry and exit, especially when having an emergency. When the CF students triggered its symptoms, it can easily go to the clinic's room or it can easily go to the comfort room. Another is to provide elevator access if available, or ramps, especially when the CF is severely ill and needs to be taken to the nurse room with wheelchair. Also, have a one-on-one aid, and that one-on-one aid, it can be routinely scheduled time over the class, especially in different dates. So this aid can be trained to look for the symptoms and to know when to take the child to the school nurse. Symptoms may include coughing, shortness of breath, and digestive issues. Another is have a modified scheduled treatment time. So if it is necessary, the child needs to be seen by the school nurse throughout the day to receive exercises or treatments to loosen and promote mucus drainage in their bodies. Another modification is the modified worksheets and notes, especially when the child is having a challenging time physically or it triggered its fatigue. Then the work expectations for the activities, the assignments, or the quiz should be modified. It might mean having the child complete every other problems or receive copies of notes taken by another student. Also, in your classroom, provide water stations because a child with CF may need to frequently drink water to keep his or her throat clear and will need to have easy access to water, especially in taking medications because CF students have scheduled time for their medications. Also, have a modified home instruction for activities or the assignments or the quiz. So it is an alternative plans need to be in place to provide home instruction when the child is too ill to attend a full day of class, but it is able to handle 1 or 2 hours of instructions. It depends on the student if he or she is severely ill that time. So here are the assistive technology for the students with cystic fibrosis. There are examples of technology depends on their level. For low-level technology examples are color coding systems. For example, in that is the highlighters, pens, colored paper, color transparency, overlays, trash balls, and manipulative counters. In the middle level, technology examples are the tape recorders or the dictaphones, timers, magnifiers, or reaching aids. While in the high level technology examples is the computers, specialized hardware, and software. But there are also common types of software, which is the speech-to-text, the text-to-speech, the writing organizers, symbols-to-text, modified keyboards, and wheelchairs for the CF students. Speech-to-text or SST. It is a software and a type of assistive technology program that converts words that are spoken aloud to electronic written text to support increased demonstration of learning and independence. SST or speech-to-text can also be referred to as dictation or speech recognition programs. So another assistive technology is the text-to-speech program. It is a program that reads electronic written text aloud to support increased learning and independence. Another assistive technology is the word prediction program. It is an assistive technology software supports written communication by providing possible choices for words based on initial spelling, syntax, and/or frequency of use, which supports spelling and grammar difficulties with fewer keystrokes. Another is the acapella physiotherapy. Later, I will show you the picture of acapella physiotherapy. So it is a device for airway clearance, mobilizes mucus from the lungs, helping to reduce infections, and is a critical but often the most troublesome aspect of CF management. And last is the Genia. It is a mobile iOS PSS created by a Swedish-based company Upstream Dream to optimize consensus building in pediatric care by improving communications between patients and clinical teams, fostering diseases self-management with clinical treatment plans. So here are the other kinds of assistive technology. First is the wheelchair desk. Especially a child with CF when he or she is sitting on a wheelchair. So another is the ramps. Ramps is used when the student with CF is sitting on a wheelchair. This is an example of environmental accommodations for those with mobility needs. So another is the assistive technology like speech-to-text software that requires the use of headphones for the students to hear the pronunciation of the text on the screen. And last kind of assistive technology is the acapella physiotherapy. This is a device that clears the airways of the mucus in the lungs. So that's all. Thank you for listening. So ask me questions if you have one. Thank you.